Hey guys, so I just thought of some things that I wanted to talk to you about. Um, so I wanted to talk about 5 work from home jobs that you can do that are healthcare related besides coding. Um, so the first one is customer service rep. So this job I know um, it deals with a lot of like phone calls, fielding fielding uh, patient issues and I guess insurance questions, stuff like that. Um, and I guess getting people to the right department. I know that United Healthcare is hiring. Most of these jobs are hiring now because they're gearing up for the new Medicare season coming in January. So a lot of these companies are hiring now. Then transcription. I've never worked in transcription. I know that they do type up the verbal physician's notes, and you have to type quickly and have really high accuracy. And they do pay per chart, which I know some people I've heard from say they struggle that like that's a downside. Like um, they struggle with trying to make sure that they meet those goals. So I think that's also I guess something if you are okay with having a part-time job that you're not going to make a ton of money with. But just, a little extra on the side would be okay. Um, so that company is Net Transcripts, and they do hire new transcriptionists, like nobody with, no one with experience. They just want you to be able to type at least 75 words per hour and have a high school diploma. Then the next one would be release of information. I don't know if they're still hiring, but I know they were a few weeks ago. I think they still are. Um, it's a release of information, so you're just releasing medical records to, I guess, the patient or attorney's office. I'm not really sure the level because it just says release of information, medical records. Um, so it's with a company called CIOX. It's CIOX. And we used to work with them a lot when I worked in the hospital. They would call just about every single day, um, at least one time or two times an hour, to look for medical records for patients, attorneys, attorneys, and just anybody. So I know the work is steady. They also have people, if you live in a certain area where they need help, and you would go into the hospital and pick up the medical records in person. That's one of their like questions they used to ask us. Could a person physically come to the location and pick up medical records? And we would always tell them no. Um, then the last one, data entry. Um, I did this, and that's how I got my current coding job, working as a data entry specialist. And it's not like what it sounds. So it was data entry, and they had two sides. One side did coding, and the other side did insurance. You could do both, but it was a lot. So because I was credentialed, worked on the coding side, and I got 5 months of experience, and I was graciously blessed with the position at the hospital that I'm currently at. But that's how I got my job. These jobs that I'm telling you guys about do not pay the greatest amount of money. They're positions to help you get your foot in the door and to help you get experience, and to also, like, I guess, save you on having to get a wardrobe for work, put gas in your tank, pack lunch. You know what I mean? It's all that money that's accumulated. Because I don't know about you, but when I work in a hospital, I tend to eat. I eat in a cafeteria, I eat out the snack machines, and I think I was spending about $50 every 2 weeks just doing that. You know what I mean? That didn't even include gas, clothes, daycare costs, because that's crazy. So, I mean, these would be really good jobs for people who are just starting out, or people who need a break and want to stay at home. I will say that the competition for these jobs are really high just because they're remote positions, they're remote jobs. Um, Other places I would look for these type of jobs would be Aetna, those insurance companies. So Aetna, United Health, who else? Um, Blue Cross Blue Shield. Though even Dell, I never knew this, but Dell actually has their own healthcare um, department, and they do hire they do hire coders, and they do hire um, people to review medical records. They do require a little more skill, a little more, I guess, education. But I never knew about those type of positions with with a technology company. So that's something to, I guess, like keep in mind. I think a lot of people focus on working at hospitals instead of working at these other places like insurance companies, or even like AAA, and these car companies, e-insurance, and all that stuff, because people get into car accidents, motor vehicle accidents, and these claims get processed through the insurance company as well, because they want payment from the insurance company. So they also have to have someone to come in and review those claims. So these are just the 5 jobs and a little advice that I had for you guys. If you were looking to stay at home, especially now in this winter season. I don't know where you're at, but I live in Colorado and it's snowing like crazy. So I'm thankful that I get to stay home. So yeah, you guys just take a look at these jobs and hopefully you get hired. Also keep networking. Keep networking. Okay. Bye.